Good evening, folks. I have discussion E for you. Now, this is a bonus one. We're discussing digestive issues as you get older, as we age. So, here we go. Millions of adults assume new digestive symptoms are just part of getting older. That can be true sometimes, but many common changes, bloating, irregular bowel habits, abdominal discomfort, can also be signs of irritable bowel syndrome or IBS, rather than normal aging. Below is a clear, practical guide to tell the difference, what to watch for, and what to do next. Typical symptoms people blame on aging. Bloating and gas, uncomfortable abdominal fullness, constipation or slower bowel movements, stools that are harder or less frequent than before, occasional diarrhea or loose stools, sometimes alternating with constipation, mild and intermittent abdominal pain or cramping, often described as discomfort rather than sharp pain. How IBS differs from normal age-related digestive changes. Pain linked to bowel habits. With IBS, abdominal pain often improves after a bowel movement, or changes with stool form. Age-related slowing usually does not cause pain tied to defecation. Patterns and chronicity. IBS symptoms tend to be recurrent and patterned weeks to months, whereas simple age-related changes are usually milder and more stable. Triggers and gut-brain links. Commonly involves stress, anxiety, and altered gut-brain signaling. Aging alone doesn't explain these connections. Modifications or medications and comorbidities effects. Older adults take more medicines and have other conditions that can mimic or worsen IBS. A careful review is essential. Red flags that need prompt medical evaluation. Seek immediate care if you have any of the following: unexplained weight loss, blood in stool, persistent fever, new severe pain, or progressive difficulty swallowing. These are not typical IBS or normal aging signs. They require urgent workup. Practical steps you can take now. Track symptoms for 2 to 4 weeks. Relation to bowel movements, foods, stressors, and medications. Review medications with your clinician or pharmacist. Many drugs cause constipation, diarrhea, or bloating. 3. Try simple lifestyle changes. Increase fluids, add more soluble fiber, gradually stay active, and manage stress with relaxation or mindfulness. From a low FODMAP trial or working with a dietitian or dietitian, older adults may need tailored guidance to avoid nutritional gaps. Bring your notes to your clinician. A clear symptom log plus medication list helps them decide whether testing or IBS directed treatment is appropriate. Treatment considerations for older adults. Non-pharmacological options first. Diet changes, fiber, hydration, exercise, and stress reduction are often safest. Medication choices need caution. Older adults are more sensitive to side effects and drug interactions. Clinicians often prefer conservative or non-drug options first. Probiotics and targeted therapies may help some people, but should be discussed with a provider. Don't automatically chalk new or changing digestive symptoms up to just getting older. If symptoms are recurrent, linked to bowel habits, or affecting your quality of life, they may be IBS or another treatable condition, and a clinician can help sort that out. Here's a clear explanation of the text based directly on the surrounding page content from your Open tab. The article is answering a common question. Does IBS actually get worse with age, or does it just change? Based on the page content, the message is not that aging automatically worsens IBS, but that aging changes the gut in ways that can shift how IBS shows up, especially in older adults. The text sets up the idea that to understand IBS in seniors, you have to look at how the gut physically changes with age. How the microbiome shifts, how other health conditions and medications interact with IBS. This frames IBS in older adults as a dynamic condition, influenced by multiple age-related factors rather than a simple worse or not worse question. How aging changes the gut and why that matters for IBS. The surrounding content explains several age-related changes that can make IBS symptoms feel different or more noticeable. Slower gut mortality. Aging naturally slows the movement of food through the intestines. The article notes longer chronic transit time, reduced peristaltic contractions, more constipation, predominant IBS, IBS-C in older adults. This means symptoms may shift from diarrhea to constipation or mixed patterns. Training the gut lining. Reduced mucosa. The intestinal barrier becomes more fragile with age. This increases irritation, inflammation, visceral hypersensitivity. The gut feels pain more easily. This can make older adults more reactive to foods that never bothered them before. Changes in serotonin signaling. Serotonin regulates gut movement and sensation. With age, serotonin production declines. Transporter activity increases, reducing availability. This can slow mortality and heighten pain perception against nudging symptoms towards IBS-C or IBS-M. how symptoms tend to shift in later life. The page emphasizes that IBS in seniors often looks different than in younger adults. More constipation or mixed type IBS, pain that may be duller but more persistent, increased bloating due to slower gas clearance, greater sensitivity to dietary triggers, sometimes reduced pain perception, which can delay noticing symptoms. In other words, IBS doesn't necessarily get worse, but its pattern changes. The microbiome's role. The article highlights that aging reduces microbiome diversity. Key points include fewer beneficial bacteria, more methane producing microbes, linked to constipation, diet changes that can either help or worsen symptoms. This microbial shift can amplify gas, bloating, and sensitivity. Comorbidities and medications complicate the picture. The page stresses that older adults often have other conditions that affect gut function. Diabetes, thyroid disorders, neurodegenerative disease, the gut, calcium channel blockers, opioids, anticholinergics, other like metformin can worsen diarrhea. This makes IBS harder to diagnose and manage in seniors. Bottom line from the page. The text is setting up a nonsense answer. IBS doesn't automatically worsen with age, but aging introduces physiological, microbial, and medical factors that can change how IBS presents, often shifting symptoms toward constipation, bloating, and heightened sensitivity. Okay, guys, that's your bonus for the evening. I will see everybody tomorrow for shows. Until then, Gator Wellness. Take care, folks.